I'm Dr. Christian Hahn. I'm a biologic dentist, a cosmetic dentist, and I practice just over here at Bozeman, right across from Bozeman High School at Saddle Peak Dental. My business partner, Dr. Hillary Fritsch, is not here today, but her husband is. Also doctor, but not a dentist, unfortunately. We're going to talk today about everything that is related to dentistry that you probably haven't heard from a regular dentist. I was a regular dentist for 15, 20 years. I did everything that you could imagine that dentists will do. Root canals, fluoride trays, irregular extractions, and then I woke up. And I launched a natural products company in California. I called it Dr. Hahn's Naturals because everybody who swam in the ocean had good oral health. And that's when I realized that it's not about the chemicals, it is about nature. And so then when I was offered to speak to you guys, it was going to be about fluoride, root canals, and mercury fillings. That's what everybody wants to know about. So I had a whole bunch of pictures of cracked teeth, a whole bunch of statistics on fluoride, a whole bunch of really ugly looking root canals that I have extracted. I extract root canals almost every single day, but you can't see them. So what I'll do is I'll take this lecture and I'll put it on a link for you guys. And if you call our office, they'll give you a link to the slideshow and you can see all the pictures that I'm talking about. So there's a health crisis going on. You guys know about that. I'm going to read you the statistics so you guys can be aware of what's going on in this world. And yes, I need glasses. In the last 100 years, there was no cavities about 100 years ago, where 92% of people now have a cavity. 92% of people. It's the most infectious disease, most infectious, contagious disease in the world. Did you guys know that? Didn't know that, right? When you have a brand new baby, it is born perfect. There's no cavity-causing bacteria in that baby's body. The first hug from the mother with a big old kiss, or a grandmother that happens to carry a bacteria called Streptococcus mutans, is when they share the contagious disease that we call dental decay, cavities. And that's when the cavity problem starts. It's an acid issue, and this bacteria flourishes in the mouth and releases acid all the time. So we are sharing this bacteria from one generation to the next, and now we have a 92% cavity rate in the world. It's good for us, terrible for you guys. There's ways to fix that, and that shouldn't even be an issue. Obesity in 1930s was 5%. Okay? We're over 42%, and it's climbing every single day. It's a huge issue, no pun intended. The big autism rate. Everybody heard about the autism rate, right? In 1 in 10,000, when we started to actually count it, I think that was 50s, 60s, 2, get this, 1 in 36 today in this country. That's a 27,000-fold increase, and nobody knows why. You guys know why. Nobody knows why. I did a little digging, because I'm a dual citizen, German-American, and I'm thinking, is the autism rate an issue only in the United States? And it turns out that there's one country in Europe that has a reversal in autism rate. One country. Luxembourg in 2018 went from 1 in 100 to 2024 to 1 in 133. Small little country. That's a statistically significant change. What did they do? They banned glyphosate. Food for thought. So, dentistry, mercury, glyphosate. So there is some things that are going on that are causing this autism rate to sky up. Heart disease. 1900s, nobody even knew what heart disease was. There was really no heart disease. Number one killer now, heart disease. The bacteria in your mouth have been linked to heart disease, 100%. It's called the focal infection theory. So your gum disease is affecting your heart, 100%. That's actually something I can say. Autoimmune diseases affect over 50 million people, and that's climbing. And diabetes was rare, now it's 11+% in the country. So what I'm saying is that modern food, medicine, and dentistry are failing us. Something's not working out. We're spending more time and money on our health in this country than we've ever done, and we've never been sicker. We have more vaccines, we have more doctor visits, we have better dentistry, and it's all going to pot. There's got to be something wrong. I'm going to share with you the dental side of it, what I see every single day, and how you can avoid falling into this trap, and how you can reverse the trend. So what is biological dentistry? Anybody know? You would figure every dentist would be a biologic dentist, right? Every dentist should want to be focused about root cause. Why are you getting cavities? Every dentist should be focused on not using chemicals in your mouth like neurotoxins or creating autoimmune diseases through constantly leaking root canals. Every dentist should be consistently trying to make you healthier, but it's turned into a business, unfortunately. What we do as a biologist is we focus on root cause. We look at you, we do an exam as why are you not sleeping? Is it an airway issue? Is it an infection? Is it that you have a bite issue? Is it that you have chemicals that are leaching in your mouth? Is it mercury toxicity? We look at all those issues, we can test for it, and we can give you a root cause analysis of why everything's falling apart. It's probably going to be chronic inflammation in your mouth. Chronic inflammation is the root cause of almost all disease. And if we don't figure out where it's coming from, we can't treat it. Is it coming from gum disease? Did you start with Streptococcus mutans as a baby and just build on that? Did you feed yourself a diet that feeds the wrong bacteria in your mouth? Are you creating an environment in your mouth that's causing you to have bacteria causing decay? Are you feeding the wrong side of the team? Right? Most likely, yes. Everything is geared towards processed food. Everything is geared towards sugar. Everything is geared towards acid. If we don't look at your diet as a dentist, then we shouldn't do any fillings. Because all we're going to do is see you over and over come back. You're not going to get better if you're eating the wrong diet. If you come and see me and you have rampant decay, and I do fillings on you without figuring out where that decay comes from, it's malpractice. I'm just using you as a farm to make money. That's not right. Biologic dentists need to figure out, why do you have decay? Why do you have TMJ problems? Why can't you sleep? If we can't answer those questions, then we will find somebody for you that can. Biologic dentists work with naturopaths. We work with IV people to prepare you for the treatment. We work with naturopaths to do muscle testing to figure out what's really going on. We do lab tests to see what kind of bacteria you have. We do lab tests to see if you have any type of mold toxicity or heavy metal toxicity or glyphosate or environmental toxins. We test before we tell you what's wrong, because we don't know otherwise. Who has heard of Dr. Weston Price? Everybody does, right? So he is the first biologic dentist. Did you know that? Why did he become a biologic dentist? He did a root canal on his son that failed, and his son died, most likely from the root canal. That's a wake-up call. When your son dies from a root canal due to a brain infection, you change your tune. So what did he do? He studied root canals. He took hundreds of root canals out of people that had certain diseases: rheumatoid arthritis, Parkinson's, cancers. He implanted those root canals into rabbits, unfortunately. And guess what happened? The rabbits developed the same disease as the tooth owner. And then you can take that tooth from the rabbit that now has rheumatoid arthritis, and you transplant it again, and it works again. It's generational. So he said, well, there's something in these root canals that's causing this problem. And he studied hundreds of rabbits, hundreds of root canals, and it always had almost consistent results. The dental associations don't want to hear that. Root canals are big business. So obviously he was ostracized. Then he traveled the world and he's looking at healthy people versus sick people. And he said that, well, all these healthy people have something in common versus all these sick people. What was the difference? Grocery stores. Turned out to be grocery stores. It's diet. So Dr. Weston Price concluded that your diet is crucial. Starting from birth, your diet. And it's a large subject on the Weston Price diet, the foundation here, that is fantastic, but essentially what it comes down to is you have to eat farm fresh organic foods. You cannot eat processed foods. You need to start as a child, 18 months of breastfeeding. You have to start as a child avoiding toxins, right? And then you develop into a real, strong, healthy human being that doesn't have any issues. The Weston Price Foundation is amazing. You should follow it. They have a very specific book. It's called, Nutrition and Physical Degeneration is the book by Weston Price. You all should read it. It's a really, really good book. And I think Nancy here is the president of the Weston Price Foundation. Really good resource on how to eat properly. Now, we could show you pictures that Dr. Weston Price took of the tribes around the world that had broad, healthy smiles. They didn't have decay. They didn't have TMJ. They didn't need extractions. They had wisdom teeth. They had no dental problems. Wouldn't you like to avoid spending $4,000 to have your kids' wisdom teeth extracted when you really shouldn't? You really shouldn't need teeth extracted. If you missed the window of growing your jaw by eating correctly, breastfeeding with your child, and so forth, you can catch up later on. My partner, Dr. Fritz, she is amazing. Airway dentist, this is her passion. She will fix your jaw, okay? So your kids can be fixed, you can be fixed. It's never too late, but you do need to pay attention to that. You should start from birth. All right, there's 3 big controversies in dentistry that I'm never supposed to talk about. I'm gonna talk about them. Number 1, everybody knows about fluoride, right? Fluoride is a neurotoxin. Until about a year ago, there was a lot of pushback on fluoride all the time. Water fluoridation, fluoride in dental practices, fluoride in toothpaste, fluoride everywhere. Fluoride in your soda, everything you drink is fluoride, right? There was a review of studies, which means they looked at all the studies we had in the world on fluoride. And guess what the conclusion was? There is no safe level of fluoride. Right? So if you're brushing your kid's teeth with a toothpaste that says, if you swallow your toothpaste, call a poison control center, who does not swallow their toothpaste? Who has called the poison control center after swallowing their toothpaste? Nobody. It is a neurotoxin. It calcifies your pineal gland. I mean, the studies are very clear. The world is much stricter on fluoride than the United States. You should avoid fluoride. You shouldn't drink fluoridated water. I'm not going to go into all the studies, but in the dental side, it causes those white spots on your teeth, fluorosis. Fluorosis chips off as you get older, and underneath it, you get decay. So all those white spots on the teeth, eventually, they're like chalk. break off, and that's dental visits. Lots of money because it's over and over repair. It continues forever. You don't want that. The second one is mercury fillings. Who has a mercury filling? Does your dentist call it a mercury filling or a silver filling? Silver filling, right? There's more mercury in it than silver. So it's not a silver filling, it's a mercury filling. Did you know, I have to read this, the statistics are great on this. Mercury fillings were invented over 200 years ago, before sewing machines, elevators, telephones, light bulbs, cars, radios, or x-rays. That's how old these fillings are, okay? And we still use them in the United States. As of January 1st of this year, they're banned in Europe. All 17 EU countries said, no more mercury. It's a neurotoxin. The American Dental Association, fine, just put it out, keep on putting it in, it's okay, it's safe. Safe and effective. Very safe and effective. As a dentist, mercury expands and contracts 2 to 3 times more than your tooth does. It works great in thermometers. It expands and contracts. If you put water into a rock and you freeze it and the water expands twice as much, what happens? The rock breaks. You drive up Highlight Canyon, all those rocks that come down on the road, winter, water, freeze, crack those rocks, and you get boulders falling down. Your teeth will crack 100% of the time with mercury. It's wonderful. I call it a seed restoration. When you're young, we put a little tiny mercury filling in your tooth, maybe 8 teeth, and then we water it with some water and some coffee over time. It does this. That's like that. And then 10 years later, it flourishes into a crown or a root canal or an extraction. Lots of money for the dentist, lots of pain and suffering for you guys. Mercury fillings, ignoring the mercury aspect, are going to break your teeth. So what do you do about it? You get there as soon as you can. You remove the mercury filling properly so you don't cause mercury toxicity. Smart method, right? You've heard about the smart method. And then you replace it with something that's not going to crack your teeth. Porcelain, composite resin, something like that, okay? So if we look at the mercury component of mercury fillings, if I take a pencil eraser and I rub it over the mercury filling once or twice, and then I put it in front of a screen, I can see the mercury vapor coming off. There's a video on YouTube called Smoking Teeth. Have you guys seen it? Smoking Teeth? Good. Smoking teeth is actually just that. They took a tooth with mercury in it and they rubbed a little pencil eraser over the top and they can see the vapors coming off. So this grinding, chewing creates more friction than that, and you're always getting mercury exposure. What's worse than a single dose of mercury is a chronic exposure of a small amount of mercury vapor. It's the chronicity of it. The constant release of toxins wear down your immune system. It's not that one big time exposure, it's the chronicness of it. So that mercury is toxic. It's a neurotoxin. It's found all over your body. It causes, I really can't tell you what it causes, but you can look it up, mercury toxicity. I want to come back one day. It is clinically linked to kidney, immune, and brain damage, that we can say. So it is banned in the EU, and we are fine to use it here in the United States. And here are some pictures of some beautiful mercury fillings that you can see. And then my favorite topic of all, root canals. Who has a root canal? I had one until last September, so I'm now root canal free. There was a documentary, it still exists if you can find it, called The Root Cause Documentary. It was on Netflix for 2 weeks before the forces who be managed to tear down the documentary and ban it from every channel in the United States. If you want to watch the root cause documentary, it's not on Netflix, it's not on Hulu. You have to go to a specific website and download it. You can't see it on YouTube. Even though it was based on sound research by one of the most respected scientists at the University of Kentucky, Dr. Boyd, who did over 3,000 studies on root canals. Okay? It doesn't matter. If you mess with $1 billion industry, you're going to get banned. So what was the study about? Well, a root canal takes out the nerve, it takes out the lymph system, and it takes out the blood supply of a tooth. Your tooth is a living organ. Every single one is a living organ. And if you kill an organ and you leave it in the mouth, in the body, what happens? It rots. You don't leave a dead kidney in your system, right? So the tooth will always have a chronic level of infection in your body. Your body cannot handle chronic inflammation. It's an acute kind of an emergency system. It likes to fix things and be done with it. When you take all those live organs, all those live elements out of a tooth, now it's a dead tooth. There's 2 to 3 million tubes in each tooth. Okay, about 3 to 5 miles of tubes that used to be filled with cells and living tissue in a tooth that cannot be cleaned out by doing a root canal. All that stuff rots, and then anaerobic, or bacteria that does not like oxygen, lives in those tubes, and then it releases metabolites or toxins into your system. Your body can get to the tooth because it's outside the body, it's in the bone. There's no blood supply. Your immune system is in the blood supply. It can never get to the infection. So every time poison drips out, the body tries to clean it up forever. That's chronic inflammation. The American Dental Association, good friends of mine, tell you that your gum disease bacteria, let me get this number here, they admit that gum disease bacteria that live in and around your gums and your teeth, okay, around the teeth, are linked to atherosclerosis, hardening of the arteries, heart disease, heart attacks, stroke, Alzheimer's, cognitive decline, type 2 diabetes, preterm birth, low birth weight, pneumonia, COPD, rheumatoid arthritis, pancreatic cancer, colorectal cancer, chronic kidney disease, and more, okay? This is called the focal infection theory. The bacteria around your teeth have been clinically linked to the things I just mentioned. They deny every single one of those links to root canals. The bacteria around or in your root canals is perfectly fine. Don't you worry. But the gum disease bacteria that cause a little bit of bleeding when you floss are gonna kill you. Think about that. Does that make sense? It's ridiculous. So when I see such a dichotomy of opinion of bacteria from a root canal versus bacteria from gum disease, and they're kind of the same, by the way, I question the forces who be. And that's when I start telling you, get informed before you do a root canal, and if you have a chronic illness, a chronic disease that's not getting better, look in your mouth and see if you maybe have a chronic infection, such as a root canal. That's all I do all day long, is I look at your scans, I ask you about your health conditions, and I see if there's any possible connection. I'll give you an anecdotal story myself. I had a root canal done when I was just out of dental school, because I'm not perfect. And it was done by what I thought was the best root canal specialist in California, right around 2000. And then, fast forward to 2024, I finally decided to have the root canal removed, the tooth removed. Many reasons. By the way, the stronger your immune system is, the less you will even notice that you have a problem. And the better the root canal is, the less bacteria that is left initially, the longer it's going to take for that bacteria to build up to the point where you will notice a problem. I started to notice a little tiny bit of achiness in that tooth. I've taken a couple scans. I decided it's going to be enough. I'm going to take it out. All right. So I went to see my biologic dentist. I had the tooth canal removed. The next day, my lower back pain was gone. And I'm thinking, that's weird. I thought it was an occupational hazard, which it is, lower back pain, neck pain. My lower back pain that I've had for 20 years, and I've seen chiropractors, it's kind of like a dental thing, right? Chiropractors and osteopaths, it went away the next day. I'm thinking that is an unbelievable change for me. I was already a believer, I was already a biologic dentist, but to feel it was crazy. So for me, it took care of the back pain. How does that relate? Your teeth are related to different organ systems in your body. It's called the meridians. Who knows what a meridian is? Good. So when I tell patients about meridians, most of them who don't know what it is are very dubious. They don't believe it at first. Because if I tell you that tooth number 14 is related to your lower back, they're going to say that's weird. No. They'll say, have you ever been through acupuncture? Oh yeah, acupuncture is fine. Yeah, acupuncture makes a lot of sense. If I put a needle in my, on my thumb, then my left ear starts to feel better. Acupuncture is the same thing as meridians. The teeth are directly connected to the largest cranial nerve in your body, trigeminal nerve, number 5. It is closer connected to your brain than anything else in your body. And it's on an energy cycle, just like everything else is in your body. And when you look at the meridian chart, or the acupuncture chart of the teeth, you can see that if I have a dead tooth on a pathway, then the energy doesn't flow anymore. It's stopped. The light bulb is off, okay? There's no more flow. When that is off, the organ system that is connected to that tooth will suffer. So look at your root canal, look at the meridian chart, and see if you have any related issues. For me, this lower back was on the meridian for tooth number 14. So was my neck a little bit. My neck got better too. So to me, root canals clearly are related to overall health. I see it daily. I don't promise anything to patients because I can't, because I like to practice. But I tell you, I've seen patients get better in many different ways. Acne, migraines, a lot of chronic inflammation, okay? It's always chronic inflammation. So that's the fluoride lie, the mercury lie, and the root canal lie. Now, there is a place for root canals, don't get me wrong. There's nothing more painful than a root canal, than a tooth that needs a root canal. If you need a root canal, it is 100% the most uncomfortable thing you've ever experienced. There's 3 pain nuclei in your brain per tooth. I used to say it's probably worse than childbirth, but that didn't come across so well. So we're going to say it's really bad, but I can't compare it. So I'm not going to. If you need a root canal, get a root canal or get the tooth removed. But if you get a root canal, look at it as a temporary solution to a long-term problem, okay? You're not going to die immediately if you get a root canal. I don't want to scare people into don't get root canals. I want to say that there is other options, and a good example is a front tooth. It's easy to say, oh, get out the root canal right away. It's bad. And then you fall down, you have a wedding in 3 weeks, and your front tooth dies, and I'm like, you got to pull that front tooth right now. And you're like, I don't want to pull my front tooth right now. I have a wedding, or my kids are going to think I'm weird, or you're only 15 years old and you can't put an implant in yet. What do? You do a temporary root canal, knowing it's not the end-all be-all, it's not going to last forever, but you have a solution to the pain and the aesthetics. And then when you don't have that pain on your head pushing you towards a decision you may not like, you can make a better decision for you. You can actually sit down and have a conversation with your dentist. All right, I had a root canal, I don't like it. What are my options, right? You can think and make a better decision. So, fluoride, mercury, and root canals. Those are the three things that are going to be very different from when you see a biologic dentist than a regular dentist. I do have to mention airway dentistry because that's something everybody's aware of right now as well. Who knows about airway dentistry? Yes. So, until now, if you went to your dentist, we did not check to see how you were sleeping. We did not check to see if you had any issues with your airway. We can now take a 3D scan in the office and immediately see if there is a constriction of your airway. It's a really great diagnostic tool to see if you have a problem. If you have an airway problem, you used to have to go see a sleep expert, or you used to have to go get a CPAP machine or something like that. Nobody wants to look like Darth Vader at night. Doesn't work very well. So there's a specialist now that can treat your sleep apnea, that can treat your sleep issues, your jaw size, and that's called an airway dentist. My business partner is the #1 airway dentist, in my opinion, in the country. She's not here today, but if you have airway issues, if you're worried about your child having missed that window of expanding the jaw so they won't need extractions, so they won't need orthodontics, so they won't need a CPAP machine or things down the line, you gotta see an airway specialist. It's all about prevention. It's very easy if you see the right person. All right. Any questions on the things we talked about? Or do I have to call on people? Yes, here. I'm gonna come back to you. Hold on. Introduce yourself since you are important as well.
Hi, and also I have a question. If a dog needs a root canal, can they just pull it as well?
How old?
A dog.
A dog. Yes. Oh, wow, that's a really good question. If your dog needs a root canal, can you just pull the tooth? I'm not a vet. Full disclosure. When my dog, Einstein, went to get his teeth cleaned once, they told me they needed to pull his molar, his dog molar, whatever it's called, because there was a big fracture on it, and so I said, no, that's okay. I'll come to the cleaning appointment, and I will fix his tooth while he's out getting his teeth cleaned. So I brought my dental tools to the vet visit, and I repaired his tooth so he didn't need a root canal or an extraction. So yes, you own your dog. You know that a root canal probably is as bad for your dog as it is for you. When they have a broken molar, they don't really fix them, they just pull the tooth. There's dentists who can fix those things, okay? I don't know any dentists here who do that, but I did. But I'd sooner pull the tooth than do a root canal. Yes. Yeah, but you should be able to fix it. Good question, Carrie. All right. Next question. Who's next?
Hi, I'm Monica. Are there any lingering issues to
Good question. Are there any lingering issues to a cavity getting filled? If you get your cavity filled with a non-fluoride composite resin, which is a company called Admiral Voco or Admiral Fusion from Germany, then you don't have to worry about the fluoride part, number one. Number two, the size of the filling is very, very important in dentistry. The sooner, the better, unless it is remineralizable, which it often is. Number three, technique is very important. There's good and bad dentists everywhere, biologic or not. I see more bad holistic dentistry than I see bad normal dentistry, unfortunately, because it's also one of those things, right? They take advantage of people. If the filling is done correctly with the right materials by a skilled dentist, then there's not going to be any issues. The issue is the edges of the filling are a little bit more susceptible to decay and bacteria than the filling than it was before. So you're always going to have to pay more attention to that tooth. If your pH of your saliva is correct and you are remineralizing your tooth rather than demineralizing it, then you should be fine. But if you don't know why you got that cavity, then you haven't fixed the root cause of it and it'll come back. Right? So the why of the cavity is the most important part. Good question. All right. Yes, ma'am.
My name is Carol.
Hi, Carol.
My question regards tooth extractions.
Yes.
I have a good dentist, and he's talked about extracting the tooth so that my teeth all fit better together, like the upper tooth, like extracting the back molars so the upper tooth above it fits better with that one because it's kind of like made a little pestle, a little kind of round there in the back tooth. And I'm very opposed to having my teeth extracted because I just feel like, why do it? Because it's part of me and I'm not sure how it's going to change my body.
Okay. Excellent question. So, the question, as I hear it, is they want to extract your molars so it fits better into your bite, essentially. Kind of like if you buy a pointed shoe, your small toe is too big, so we cut off the small toe so it fits better in the shoe instead of buying a different shoe. Yes. Okay. It never was a good idea to pull a tooth if you can fix the problem. Expanding the arch gives you more room. There's braces that are clear. There's braces that are like Invisalign that just, you don't even see them, that can realign your teeth. Pulling a tooth is a permanent situation that's going to have negative consequences. Every tooth that comes out is going to put more stress on the adjacent teeth, and it's going to take that tooth and it's going to wear out a lot faster. So you want as much chewing surface area as possible. So to me, it sounds like you might need a second opinion to a dentist that is a little bit more biologically oriented. Yes. Yeah. All right. Next question. I'm gonna reach right through here.
I have two questions.
Yep.
Are implants safe? Number one. Number two, is sealant safe? I got really sick. I'm going to be vulnerable now, but I got really sick from having breast implants and having them removed. I'm really scared about getting an implant, but I have a molar on this side that I can't take out.
Oh, excellent question. Yeah, I see people like this all the time. Good choice, by the way. Let's start with the implants. There's nothing more natural than nothing in the bone. So having no tooth at all is safe. If you need an implant, and I'm an implant specialist, so that's what I do. Implants can come in ceramic or titanium. Titanium, in my opinion, is a big no. for many reasons. The studies show that a titanium implant will have a 22 to 50% chance of a chronic inflammation around the tooth, the implant, and the sides. Chronic inflammation. Not good, right? Ceramic implants, 0% chance of inflammation around the implant for many reasons. And negligible to almost 0% chance of inflammation around the implant. That is a big difference. I don't know if you are biocompatible with ceramic, so I would use a muscle tester, such as Sherry and Healthy Out West. They have all the materials we use. They'll test your own body for the ceramic we use. And then we will know. Don't do titanium. Second question, sealants. Most sealants are fluoride. We don't use fluoride sealants again. You use a non-fluoride sealant. You do use a sealant if the groove is very deep and your toothbrush bristle cannot reach into the groove, especially for kids because they're just not very good at this. So they're going to get decay, most likely because they eat bad stuff. So a sealant, a very, very minimal amount of sealant helps. If done correctly, you got to etch it, you got to use an adhesive. They skip this step all the time. And then you use a tiny bit of sealant. No drilling, nothing like that. So yes, a sealant is safe. All my kids, I seal their teeth with a non-fluoride sealant, just a tiny bit. But very good question. I see Dr. Bott, my friend, the osteopath, is next. So I got maybe a couple seconds left for a couple more questions. And then I got to probably pass the mic on to him. Who's next? One more good question. Yes.
Maybe you've already answered this, but post-extraction, if you had to get one year of pay or something, do you have like a recommended diet you have people follow?
Yes. This is my favorite question. Post-extraction, you had a tooth removed. Do I have a specific diet that I recommend? Yes, 100%. Before you get an extraction in our practice, we check your vitamin D levels. We want to make sure you're healthy enough. We want to make sure that you're taking the right supplements, the right diet before you do the extraction. Then you do the extraction, hopefully biologically, IV, glutathione, vitamin C, magnesium, all that good stuff.